we've gone to a lot more topical therapies, especially for like skin stuff. So when I first started practicing 20 years ago, like we would give out antibiotics for skin infections really pretty regularly, and now it's a fairly rare that I have to do that. We get a lot further with some of the new medications for allergies, and then combining that with topical therapies.
We make sure that when we dispense an antibiotic, that it's dispensed for an appropriate time frame and that the client completes the process that we start. We make sure that if we send an animal home with a topical medication, we apply it in the room. We show them how to apply it. If they are on an oral medication, we will show them how to give the medication orally. It's spending a lot of time with the client and letting them know why we're treating the pet, what we're using, why we're using it for the length of time we're using.
I do want to stress to them, even if you start to feel better, go ahead and complete the antibiotics. So just some further education that even if you're symptomatically starting to feel better, you could still have bacteria present. You could create some more resistance if you don't take the complete course. The system as a whole has an antibiogram that we can reference to look at resistance patterns for our local population to help guide us for different types of infections, different bacteria, and even different locations of the bacteria within the body. So it's a very helpful reference for the providers to look at to pick the appropriate antibiotics.
When you're going to send someone home with either supportive and or antibiotic treatment, I've kind of initiated thresholds for myself in treatment. How long have you had symptoms? What are your symptoms? Do those symptoms meet that threshold? So I've kind of built my own kind of algorithm in certain situations for antibiotic use. We have a pharmacist dedicated to the emergency department. So we're able to talk to them about the appropriateness of antibiotics, which antibiotics may be more appropriate given that situation.
They have developed, at least for within our own clinics here, the ability to have a dashboard where we can trace diagnoses along with antibiotic use. And it really gives us a means of looking at, are we being good stewards and how can we improve that?
Recently started a quality improvement project initiative that focuses primarily on current guidelines as it relates to treatment of common infections that we see. We are focused on literature review and looking at current guidelines for those diseases and current antibiotic prescribing measures. We also utilize something called a SNAP or wait and see prescription. Those we send to the pharmacy with a caveat of do not fill unless the parent calls. That has significantly reduced our use of antibiotics.